psychosis episode and schizophrenia treatment include the first generation of the psychiatric medication. So antipsychotic medication is the first line of treatment, and plus the intervention is first line of treatment for psychosis and psychiatric condition is the first line of antipsychotic medication. And high potent include the Haldol, fluvaxine. The advantage of this strong medication is like the Haldol is they have a strong dopamine blockage and less sedative. However, the risk is they have a EBS symptoms and tardive dyskinesia. Low potent medications like clozapine, the risk is sedation and low blood pressure and also anticholinergic effects. Second generation antipsychotic medication is the preferable due to improve the ability, and example and key medications include Risperdal, Barbazole, Clozapine, Seroquel, Barbazole, carbamazepine. And however, their side effects include they increase the prolactin, they increase QT prolongation, they have low risk of metabolic risks, they have a low risk of EBS symptoms, they have, however, they have increased sedation and weight gain, and also they have tardive dyskinesia risks. Clozapine is the most effective antipsychotic medication, and it indicated treatment-resistant schizophrenia, persistent suicidal risk, and side effects, and major adverse effect of clozapine is the colonocytosis, and it requires absolute neutrophilic count, and other major risks are cardio-inflammation, seizure, severe constipation, metabolic dysrhythmia, and metabolic syndrome. Long-acting injection antipsychotic medication is used for medication compliant, frequent relapse patients, poor insight. Examples of long-acting injection antipsychotic medications include Haldol, fluvaxine, Risperdal, Barbazole, aripiprazole, and they prevent relapse and medication compliant. Treatment-resistant schizophrenia is a failure of two antipsychotic trials, and clozapine treat that. Antipsychotic medication can be combined with the psychotherapy and psychosocial treatment. Medication alone is not sufficient. Cognition behavior therapy, cognitive behavior therapy for psychosis is the goal to reduce stress from hallucination, challenge maladapt behavior, and improve coping skills. Family psychoeducation reduces the relapse and hospitalization. Support employment improves the work function and quality of life. Social skills training is to target communication and relationship and community function. Suicidal risk in psychiatric disorders include high risk, recent hospitalization, depression, substance usage, common hallucination, and previous attempts. Young male patients, early illness, Clozapine reduces that risks. What are the labs to monitor? The labs to monitor for the antipsychotic treatment include the base weight BMP, waist conferences, blood pressure, blood sugar, lipid, and movement disorder assessment. You want to set up a follow-up monitoring to assess the weight changes, metabolic abnormalities, EBS symptoms, prolactin symptoms, and adhesiveness to the medication. So, extrapyramidal symptoms or EBS include acute dystonia. Acute dystonia is a timing is hour to couple days. Symptoms include neck stiffness, eye rotation, muscle stiffness. Treatment include benzotropine, akathisia is also a symptom from the psychiatric medication, and symptoms include linear restlessness, inability to sit still, and treatment is a dose reduction and propranolol and benzodiazepine. Parkinsonia is the symptoms include tremors, tachycardia, rigidity, and treatment include anticholinergic medications and dose adjustment. Tardive dyskinesia is late onset and is involuntary facial movement and tongue movement. Treatment is to reduce the medication that is causing the movement and felbenzine and duotetrabenazine. Neuroleptic malignancy syndrome is a medical emergency, and symptoms include severe rigidity, fever, aromatinic instability, altered mental status, and elevated creatine. Treatment include stopping the medication, antipsychiatric medication that is causing that symptoms, supportive care, and dentrolene. Dentrolene or brocancretine if it's severe. So, psychosis is the symptoms, not the diagnosis. Psychosis is the symptoms, it's not the diagnosis. Always rule out medical conditions and substantive conditions that causes before diagnosing a psychosis. Negative symptoms of psychosis predict disability and more than the positive symptoms of psychosis. Clozapine remains the gold standard for treatment-resistant schizophrenia. Long-acting injection reduces relapse caused by non-compliance to the medication. Early interventions improves the long-term outcome. Cannabis use is associated with increase of psychosis, particularly in the general vulnerable population. Never increase the antipsychotic dosage without evaluating the compliant substance usage and diagnosis. Thank you for joining me today.